Hello, hi. My name is Ruth Anyango. I am a fifth year medical student from Moi University, and I'll be taking you through my presentation today. So I did a study in Kakuma Refugee Camp on the assessment of mental health and psychosocial support needs of refugee students in Kakuma Refugee Camp. So just before we start, I want to define two definitions. Mental health, I will use the WHO definition of mental health, which defines it as a state of well-being in which every individual realizes his or her own potential, enabling them to cope with the normal stresses of life and enabling them to work productively and fruitfully, and making them able to make a contribution to their communities. Yeah, and the Interagency Standing Committee also defines mental health and psychosocial support as any type of local or outside support that really aims to protect psychosocial well-being and prevent or treat mental disorders. Yeah, so with that background, I can move to the introduction. So this is a photo of Kakuma Refugee Camp. All the photos in this presentation were taken with consent from the participants. Kakuma Refugee Camp is in Kenya, in Turkana County, which is in the northwestern part of Kenya. It is one of the largest camps in Sub-Saharan Africa, with a total of 200,000 refugees, predominantly from the Somali and the South Sudan, from the Somali and the South Sudan, from the Somali and South Sudan countries, nationalities, sorry. And most of these refugees have undergone severe psychological and physical effects, and this kind of things really impair the mental health and also really has a direct impact on their daily functioning. So the importance of this study is when I went to the camp was to really find out the effect of this past events on their mental health, because this is not only important to inform policy, but more importantly, because it actually acts as a way to restore their dignity and in the wake of human rights, and also to provide a form of justice for these refugees. It is also important because when we understand the impact, the traumas, or rather the impact of the events on their mental health, it helps us to prevent future cycles of violence, and also it enables us to promote peace building. So this is why this study was very important. So my objectives were really to identify the mental health problems and the psychosocial support problems facing refugee students in the camp. I also wanted to really explore problems and also really figure out how they are coping, and also to explore their perceptions about whether there is a need for those services, whether they exist, is there a gap, and what can be done to minimize that gap. My study site was at Kakuma Refugee Camp. Specifically, we went to Somali Bantu High School. Our study population was high school going students within the camp. I used two tools, one quantitative and one qualitative. The WHO UNHCR assessment schedule of serious symptoms was used for as a quantitative tool, and the participator and the perceptions by severely affected people was used as my qualitative tool. I analyzed my data using SPSS and or using other quantitative methods. So on to my results. We had a total of 30 participants. 49% of them were male, 51% of them were female. 93% of most of them were single. Most of them were actually Muslim because they were mostly from North Sudan, and most of them had stayed in the camp for between 0 and 5 years. Most of them were coming from Somalia and Sudan because of the recent civil wars that have really hit those specific countries. On their nationalities, like I've reported, most of them were from South Sudan and Somalia. Those are the respective percentages. So really trying to find out what mental health symptoms the students had. Most of them were severely upset about the war, and also they were And also, most of them felt unable to carry out their essential activities for daily living, and many of the students were angry and they felt very out of control. Most of the students felt very traumatized and very angry, and they really felt out of control most of the time. Also, on looking at the psychological and social distress, most students reported that they felt alone, and most of them and they felt neglected, and this was because most of the students live in child-headed homes. Most of them actually, their parents died, or most of their family members and close relatives died, and as such, they felt very abandoned and alone. The camp is also managed by the UNHCR with the government of Kenya, and there's a lot of shortage when it comes to food, uniforms, books, stationery, and other amenities, and this creates a feeling of anxiety, sadness, and stress for most students. When it came to coping strategies, we realized that socializing had a very important role in helping the students cope. Most students reported that they would either talk to a friend or a relative or teachers, and that really helped them to cope, not permanently but temporarily, with the problem. And a big number, 32%, actually did nothing. They just, most of them were not able to do anything. 12%, which is quite significant, also resulted into fighting and getting angry and lashing out at other students or people around them. On to support services needed. When we asked the students what they needed to help them what support services they felt that they needed due to the effect of the traumas they had on the mental, 34% said they really would want counseling and psychological support, and that was very varied. Most of them reported that they'd want more people to talk to them, more teachers to talk to them. They would want more family around if it's possible. I remember some of the students actually reported that they would want people to go look for their parents and find out if they're alive, because that would give them closure. Another significant 27% reported that they should be improved living conditions. So lack of that the UNHCR and the government should look into food and water and stationery and all these other amenities, because that was a constant source of stress for most students. So on to my conclusion. The refugee students in Kakuma definitely experience a lot of mental health and psychosocial support problems, which included sadness, fear, anger, and hopelessness. And due to that, they have behavioral difficulties. Very many of the students report that they find it very hard to really concentrate in class, and that led to deteriorated performance. Also, they are not able to socialize effectively with others, especially those who have been in the camp for the past few years or the past few months. This also led to the conclusion that there is definitely an express need for mental health and psychosocial support services among those students. So my recommendations, I broke them down into 4 recommendations based on my conclusions and what is feasible. We think that promoting early detection of mental health conditions is paramount to elevating this condition. Also, improving the living conditions of those refugees is good, because it would act as a less source of stress. We need to also have community-based interventions, which are not necessarily stemming from the health sector as such, but just really having people around, because most of these refugee students get their support system from family and friends, and so we need to have interventions in the community that really focus on resilience, on skill building and self-efficacy, as well as promoting coping skills and strategies which are also effective for the students. We also looked at the fact that we need to strengthen the already existing outreach services within the camp. There is very minimal interventions that are being done on mental health in Kakuma Refugee Camp, yet there's a significant gap, or rather there's a significant issue to be addressed, and so that needs significant strengthening. I want to acknowledge the BSI Moi University local chapter for the great work they did in collecting this data and in really producing the final paper. Our patron, Professor Elena Fish, for all the support she gave us, Dr. Patel, as well as BSI Toronto, not forgetting Window Trust Kenya and UNHCR for all the help they gave us when we entered the camp. And thank you very much. That's the photo of the participants and some of the students we met, all taken with permission from the students. And thank you for your time.
Thank you so much, Ruth. That was a wonderful talk. We have a couple of questions for you here. So Payam was asking a question. Is it possible to use a remote connection to those in need of mental health support? As the refugee camp is not accessible for everyone, could psychiatry consults be by Skype or similar methods? And would that be beneficial?
Yes, I think that is definitely worth exploring. When we were in the camp, we went to the local district hospitals, and while there, there are existing collaborations between some hospitals in Nairobi and the camp, and so telemedicine is definitely working, and I think psychiatry solutions can be also transmitted via phone or Skype or whatever.
Okay.
Yeah.
Great. And another question is, are there any strategies in place to evaluate the effect of the strategies that will be implemented and if they're effective or not?
Sorry, come again?
I was wondering if there's a plan for evaluating whether the strategies implemented are effective.
I think the only there are strategies which are there in place already. Sorry. We hope to keep going to the camp and use these assessment tools and do our pre-post evaluation analysis. However, I'd also want to say there's hardly nothing being done on mental health in the camp. So from a broader perspective, there's very minimal things being done. But as BSI, we hope to take the challenge and conduct every year.
Okay, thank you so much again. We really appreciate your time, and it was wonderful hearing from you.